Are you 4 weeks post-surgery, maybe 6 weeks post-surgery, and you are still swollen? Maybe you're even 6 months post-surgery and you are still concerned about the swelling in your knee. Well, I am here to tell you that that is completely normal and expected. Of course, there are some instances where it may not be normal, which we will talk about today, but there are a lot of tips and tricks that I can give you to help you with your swelling control, which we will go over today as well. My name is Dr. Samantha Smith. I am a physical therapist that specializes in knee replacements. I have dedicated my whole YouTube channel here, my Instagram, my TikTok, my Facebook group to knee replacement recovery to help you guys. I also have a website, succeedcourses.com, where I've written a ton of blog articles for you guys, detailed information. I instruct 4 courses on my website, and I have exercise classes on my website for those of you who want to work with me directly. Please go to succeedcourses.com, check it out. I promise you won't be disappointed. So let's get into today's topic. A lot of people are concerned about their swelling. They're concerned, is it normal? Should I still be swollen? I'm 9 months post-surgery. Why am I still swollen? The only time swelling is not considered normal is if you haven't been swollen for an extended period of time and then all of a sudden swelling comes on out of nowhere. That is definitely a red flag, and you want to contact your surgeon right away. That could be a variety of things. I won't go into listing them, but definitely contact your surgeon if swelling, pain, maybe the inability to weight bear on your knee happens all of a sudden. You need to contact your surgeon. For those of you who have been dealing with swelling since day 1 post-surgery, now you're at 6 months post-surgery, yes, it is normal. The swelling is the healing process. All those cells in there have the ability to heal the knee. Your red blood cells have nutrients in them to help heal your knee. Your white blood cells clean up the area that is injured. So that is what's happening. There are some tips and tricks that you can do to reduce the swelling. You might be thinking, if all of those cells in there are helping me with healing, why would we want to get those cells out of there? So swelling obviously causes a lot of other issues: pain, stiffness, tightness, the inability to contract the muscles, the inability to get your range of motion. So we do need to get some of that swelling out of there so you don't have all of these symptoms. So there is pros and cons. We do want to manage your symptoms, but we do want a little bit of that inflammation in there, which is going to be in there anyways, regardless of how many of these tips and tricks you're going to be doing. It's just part of the healing process. Another thing to consider is your comorbidities. Are you diabetic? Do you have heart conditions? Do you have vascular issues? All of those things contribute to poor fluid retention, things like that. We want that fluid to reabsorb into the lymphatic system, recirculate throughout the body. If you have issues with circulation, if you have heart conditions, and like I said, vascular issues, it is more difficult to get rid of the swelling. You might have it for longer. So that's why we help you as physical therapists with these symptoms. So let's go over the tips and tricks next that you can try. A lot of people will have increased swelling when they're standing for long periods of time. So think about if you're standing in line, you're washing dishes, you're at the grocery store, things like that. People will start to have that stiffness and that tightness feeling in that leg. And that's when that swelling really accumulates. So if you are at the kitchen counter washing dishes or standing in line at the grocery store, you could do some ankle pumps to help the fluid push back up throughout the body and kind of recirculate. So the ankle itself, it acts as a pumping system to help pump the fluid that is stuck in the lower leg and bring it up into the body to recirculate it throughout the body. So ankle pumps are one of my favorite exercises. You can do them in standing if you are already in the standing position, or let's say you're watching TV. You can sit in your chair or on your couch and you can do your ankle pumps. Totally fine to do it this way. If you're in bed, you can do your ankle pumps. If you're in the recliner relaxing, do your ankle pumps to help recirculate that fluid throughout the body. That is a great way to do it. Another thing that helps swelling is elevation and ice. Let me show you what to do. I'm demonstrating this on the floor, but of course you don't have to be on the floor. This is just where I am today. But elevating is key to helping the swelling and the pain, of course, too. So you're going to need 2 pillows. I have a pillow and a blanket, but just 2 things to help elevate your leg. You want the toes over the nose level or foot over heart level. You need gravity to help you move that fluid out of the lower leg and out of the knee. So this is what it's going to look like. You're going to lean back. You're going to put that foot up onto the pillows. And you want, again, if I'm leaning all the way back, if my head doesn't hit the wall here, you want the toes over the nose level. So you can see this is a great position for the knee in this instance to help remove some of that swelling out of the lower leg. Again, in this position, you can do ankle pumps. That is a great way to pump that fluid out of there. And in this position too, put some ice on that knee. The ice is going to constrict those blood vessels and kind of decrease that fluid into the knee. So those are those 3 tips for you right there. Elevate with ice and do the ankle pumps. That should really help you with the swelling control. Hope that helps. Thank you so much for joining me today. I'll be posting a video every week, so please come back and check out my YouTube channel. Please follow me on Facebook. I have a great support group for you guys, Instagram, TikTok, and of course, my website, succeedcourses.com. Thank you guys so much.